Welcome to our Epilepsy Center at Abbott Northwestern Hospital. Our Epilepsy Center is an affiliation between Minnesota Epilepsy Group and Abbott Northwestern Hospital. This is a Level 4 Epilepsy Center designated by National Association of Epilepsy Centers, and Abbott Northwestern is also ranked 33rd in nation for neurological care.
Level 4 epilepsy centers will do really comprehensive evaluations for epilepsy surgical evaluation, for differential diagnosis as to what type of seizures patients are having. And so it allows us to do the most comprehensive care possible to give the best possible outcomes for our patients.
Epilepsy Center involves a team of neurologists, neurosurgeons, advanced practice providers, neuropsychologists, psychologists, social workers, technologists, and also nursing staff.
This is a epilepsy monitoring unit which is newly built and has the cutting technology to allow us to take best possible care of our patients. So what we're going to be doing with this video is going through a tour of the epilepsy monitoring unit.
To make the most of your stay here, we do recommend that you bring comfortable clothing. The length of your stay is going to depend on the goals of the admission. To help pass the time, we do recommend bringing activities with you, including handheld gaming devices or laptop computers. However, it's important to know that you won't be able to use those devices while they're actively charging because it affects the quality of the EEG.
Hello, sir. I just want to introduce some of the safety measures we're going to be having here while you're staying here at our epilepsy monitoring unit. People can fall with their seizures. They have a real potential for injury. So what we want to do is make sure you're safe. So part of that, nursing staff will be here soon, and they'll be putting in an IV, and that'll allow you to, if we ever needed to give you a seizure medication urgently, we could just give you it through the IV, so that would be really helpful. The other thing is there's going to be seizure pads, so on the bed rails, and we'll have pads that will be kind of on the floor here to make sure that you're safe. Some of our other safety issues, we have staff monitoring your EEGs, and they're very closely monitoring your EEG and your video data to make sure if you're having a long seizure that we alert the appropriate staff, so that's a safety measure. Another safety measure is that we make sure that when you're getting up, when you get out of the bed, we want to make sure you're safe. And so things like you have to make sure nursing staff is aware, because they're going to make sure you're safe in the bathroom. They're going to also make sure you're safe in getting into a chair. There'll be a helmet that you'll want to wear when you're up and moving, or when you're sitting in the chair. So there's going to be some really important safety measures that we take, because again, we don't want patients to fall and be injured. We've noticed this with our new epilepsy unit. We're taking steps to make it as safe as possible, and because of those steps, we really feel like it's a great advance for our patients.
Once you arrive at the unit, one of our highly trained technologists will start connecting you to EEG. This includes measurement of your head so that they know where to put the electrodes to record activities from all over your brain. The electrodes are glued with paste and glue. The glue is fast drying and removable, but it does have strong smell. If the smell bothers you, please let our technologist know.
That's what an EEG does. It picks up the brain waves coming from the neurons on the surface of your brain. And so the EEG will allow us to figure out a lot of really important things. First of all, those brain waves can tell us whether your brain waves are perfectly normal or whether you're having some abnormalities that might give us clues as to what type of seizure you're having. So for example, you might be having these things like little spikes. So spikes can give us an indication of where in your brain seizures could be coming from. For example, if you have spikes coming from this, maybe from this temporal lobe, you see a little spike, that can give us a clue that that's where your seizures are coming from. Another possibility is when you have your full seizure, those spikes would build up into a full-blown seizure activity. So what a seizure is abnormal electricity coming from your brain, and that's what those EEG electrodes will pick up, that abnormal electricity. So imagine, let's say I have abnormal electricity coming from the left side of my brain. That might give me some jerking activity on the right side. For your seizures, we're going to be using these electrodes to really figure out what your diagnosis is, so we can really get on with the best possible treatment. So a common goal when patients are admitted to our Epilepsy Monitoring Unit is to record their typical seizures. So part of that's where things are really tailored to the patient. Some patients are on seizure medications. We may lower and eventually stop their seizure medications. Some patients may undergo sleep deprivation because that's a well-known way to trigger seizures. Some patients will have flashing lights or hyperventilation. And some patients have their own unique triggers for their seizures. So what we do is we do a very thorough history, talk to the patient about what the best way to trigger their seizures are. Because what we often want to do is record the patient's typical seizures and figure out what the best treatment is.
I think he's having a seizure.
Hey, Jeff, can you look at the ceiling? Point to the ceiling for me, Jeff. Can you tell me your name? Look over here. Remember this object for me. Hey, how you doing? You point to the ceiling for me? Remember the color purple. There you go. Can you point to the ceiling for me? Good. Good. What object did I show you? Can you tell me your name?
Jeff.
Good. Can you tell me where you are?
I'm in the hospital.
Right. You're at Abbott. And I think you might have just had an event here while they're hooking you up. You're okay. All right.
What I like to do is review the rounding process. We think rounding is extremely important while you're here because communication is one of the most important things in the hospital setting. We want to make sure we're being very clear, giving you really good updates. So here's how we do our rounds. When you first arrive here in the hospital, you're going to meet many members of our team. A lot of times what we're going to do is we start with a very detailed history and physical. So we really know your history on seizures and we can really understand what the goals of the admission are. So you're going to meet our team very shortly after you arrive. The way we round on a daily basis is you'll have a team approach in terms of rounds. So you'll have rounds with the epileptologist. So myself or one of my colleagues will be rounding with you. In addition, you'll have one of our APPs, so nurse practitioner or physician assistant. You also will have we'll have other parts of the team. Nursing staff will round with us many days. We'll have the psychologists, neuropsychologists, social work, really the full comprehensive team. That way, when we round with you, we can have really good communication. So what we do is, the first day you're here, we get the details on the history and physical. Other days that you're here, usually in the morning, we're going to be rounding, usually somewhere between about 10 and noon, we do our rounds. And you'll round with various parts of the team. Some days it'll be the whole team. Some days it'll be just the epileptologist and maybe one or two other people. But again, we try to make sure that communication is really good throughout the hospital stay. Both our communication to you, but most importantly, answering all your questions.
During your admission, you will undergo neuropsychology testing that will test your cognitive functioning. This type of test may take up to 8 hours, or it may take shorter based on your individual needs. A psychologist will also meet you to assess any other psychological needs and address issues such as depression, anxiety, or any other life-related conditions. For programmed admits, social worker team will also meet with you to assess any care needs such as related to school, job, or any other life-related situations. Team of technologists will also work behind the scenes 24 hours, monitoring your EEG continuously to evaluate for seizures that can be missed clinically.
Communication is really important, as we've said a few times during this video. And one of the ways we want to make sure communication is really excellent is at the end of your admission, we try to summarize all the information, all of our findings, and also what the plan is after discharge. So usually this takes place on the morning of your discharge. It often has multiple members of the team, and we try to be very, very thorough. We usually have the patient, patient family members, and the epileptologists and other parts of the team to make sure we communicate what was the finding on the EEG, what are the finding on any imaging that you may have had, and of course what your seizure types are. All this information will lead to the best possible treatment, and will be very clear on what the treatment will be. And that's a really important part. We think the discharge summary, or I should say the discharge conference, is a very important part of the evaluation.
Hope this video was informative and provided you with the reassurance you need before your admission. Minnesota Epilepsy Group hope to give you highest quality of care.
Thanks for watching.